The Pink Pad from Xodus Medical has been designed specifically to address the unique challenges of Trendelenburg positioning. This single-use three-part positioning system includes the Pink Pad, a lift sheet, and body strap. The material of the Pink Pad molds and conforms to a patient's contour and has a high coefficient of friction that safely holds the patient in place. For correct setup, the Pink Pad must make direct contact with the patient's skin and the OR table pad. Additionally, large grounding pads are also an acceptable contact surface. Linens or table covers should not be used in conjunction with the Pink Pad, as they will inhibit the friction that holds the Pink Pad to the table. The only item that should ever be placed between the patient's skin and the Pink Pad is the provided lift sheet, and only in a manner consistent with setup instructions, permitting direct contact with the skin of the sacrum and scapular regions. To position a patient, begin with a level OR table. Place the Pink Pad at the very edge of the middle table segment, nearest the perineal cutout. The white Velcro straps of the Pink Pad's underside should make contact with the table pad, with the "this side up" labels facing upward. Next, attach the 4 Velcro straps to the surgical table's accessory rails. Pass each Velcro strap between the table and accessory rail, under and back over the rail. Affix the free end of the strap to the portion extending from under the pad, and then secure the enclosing flap as shown. Repeat this procedure for each of the 4 straps. Make certain that the Pink Pad is fastened securely to the table. Should the placement of a strap coincide with an accessory rail bolt, the preferred placement of the strap would be to the side of the bolt that will be nearest the stirrups, as this will provide a secondary measure of safety during table inclination. Place the lift sheet over the pad as shown. When the patient is placed on the pad, the lift sheet will be situated between the patient's sacrum and scapula. The lift sheet will be used to help reposition the patient and later tuck the patient's arms. Place the patient in a supine position on the pad so that the shoulders do not extend beyond the end of the pad. When repositioning the patient for proper application of stirrups or intubation, use the lift sheet to help raise the patient up and off of the pad. Be careful not to drag the patient over the pad, as the pad must remain flat at all times. Skin contact with the pad is essential to maintain proper position. The skin of the sacrum and scapular regions must be in direct contact with the surface of the Pink Pad. Once the patient positioning has been finalized to include stirrup placement, tuck the patient's arms with the lift sheet per hospital protocol, tucking the lift sheet between the patient and the pad as shown. For added protection of the arm, ulnar nerve, and fingers, we recommend our one-step Trendelenburg arm protectors, the safest, fastest method for ensuring complete arm protection. The final step is to attach the 2-part body strap over the patient's chest as a secondary support for procedures that require the table to tilt laterally. Begin with the body strap component without the Velcro strip. In line with the patient's chest, pass the end of the strap between the table and the accessory rail from underneath. Place the buckle over the free end of the strap and draw the entire length of the strap through the buckle to secure the strap component to the table. Then, place the strap component over the patient. Repeat this step on the other side of the table with the hook side of the attached Velcro strip facing downward and away from you. Draw the 2 strap components together, placing the second component over the first and attaching them with the Velcro so that the strap is snug against the patient. The patient is now ready for Trendelenburg positioning. For more information, visit xodusmedical.com or call 724-337-5500.